So as a medical student, I really didn't know what field I wanted to go into, although one of the first things we do in our first year is gross anatomy, and I think that's where a lot of people who end up in surgical fields develop a bit of an inkling or hint that surgery's of interest. As I went through my rotations at Columbia and being active in sports, I really kind of found myself drawn towards orthopedic surgery. And then as I rotated through as a third year, that confirmed it for me because it was kind of the perfect blend of my interest in anatomy and function, kind of surgical techniques. And the department there has a really strong, rich tradition in orthopedics and particularly shoulder surgery. And so that drew me into developed a deep interest in shoulder surgery and sports medicine in particular. I was fortunate to stay in New York for residency at the Hospital for Joint Diseases, which is an orthopedic specialty hospital at NYU Medical Center, and one of the busiest orthopedic centers in the world. We've been receiving some nice press in recent years from the U.S. News and World Report, but really amazing residency training, and got a really broad and deep exposure to kind of really kind of cutting edge techniques from world experts. But again, a place with a really, really strong, our chair is an expert shoulder surgeon, and spent a lot of time there. And then I spent a good deal of time with the sports medicine faculty there, which led me into my fellowship in Houston. One of the big draws there was the opportunity to train with and work with the professional sports teams in town and all of their experienced team physicians. There were really some great mentorships along the way at all of these steps. And then as I've gotten out of into practice and now am training resident and fellow surgeons myself, I've tried to sort of take all of these techniques that I've learned too and mentors I've learned from over the years, and then kind of develop what works best in my own hands. One of the things that I'm constantly trying to do is relating surgery to sports is just practice week in, week out, get better, hone your craft. In a lot of ways, I look at surgery, my OR day is sort of like game day. And so just like an athlete goes and practices week in and week out, if I'm working on a new technique or have a particularly complicated case, I'll go to the lab and kind of rehearse it on instruments or in a cadaver setting, have the kind of whole thing mapped out in my mind beforehand or even written down. Or one of the cool things we've been doing lately actually is templating a lot of cases using 3D software, for example, to plan implants and sizes in advance of surgery. So always trying to bring sort of the latest technology to cases. But it really is even the night before, kind of falling asleep, visualizing the steps of the case. I mean, everything is sort of planned in advance and rehearsed. And I think that all goes back to just a really, really rigorous training, and then really kind of one of my roles really just trying to continuously improve and kind of keep getting better as a surgeon so that each case I'm doing is better than the last one. And that's really my goal in surgery. Is to kind of execute the surgery as best I can on game day and to get better and better.